Hi there. How are you doing today?
Great. How are you?
Doing very well. Could you please just introduce yourself, your name, title, a short bio about you and your credentials, and then the hospital and team you're part of?
Of course. My name is Marcelenor Joseph, Patient Care Director for the Dual Focus Unit here at Gracie Square Hospital. I've been a nurse for over 8 years and I've been affiliated with New York Presbyterian for the past 7 years. I have a master's degree in nursing and currently working on my DNP.
Hi, my name is Lindsay Ostrander. I work as a clinical nurse manager on the dual focus unit at Gracie Square Hospital. I started here as a staff nurse in September of 2020. I've been a nurse for 3 years, but I've worked in psychiatry for going on 7 years. And I've worked in different roles as a nursing assistant, a tech, and now as a nurse manager.
That's awesome. Why did you decide to submit your team for the All Pro Nursing Team Award?
The dual focus team consisted of strong independent nurses that continue to raise the bar in their nursing career and their nursing practice. Our focus here is on patient-centered care, and the nurses and the nurses assistant are so motivated to promote that patient-centered care, and what's always driving their practice is evidence-based. So everything we do, we're guided by evidence-based research.
Awesome. So, as you said, your team is known as the Dual Force Program. Could you give a little insight into what specifically that program does?
So the dual focus program is a unit that's a 35-bed unit at Gracie Square Hospital that treats patients with co-occurring substance use and mental health disorders. So we see patients that can be very acutely ill and sometimes coming down from withdrawing from substances. And our team does a great job of meeting our patients where they're at, providing an empathetic and non-judgmental response, and trying to reorient people back to either, if their goal is sobriety or safety, maintaining their mental health on their medications and getting them to the community resources they need. So our unit is acute inpatient, and then frequently our patients, they will either go to rehab or they will have like teams that are out that support their needs in the community.
Awesome. You guys do have a partnership in which you distribute naloxone kits at events and to discharged patients. What do these kits do to help these people after they're discharged or just in general?
So naloxone kits are used to reverse opioids. So opioids are things like heroin, fentanyl. Somebody with a substance use disorder, they might be using a substance that's not opioid related, but recently there's been an uptick in fentanyl, and that's pretty much a clear powder that you can't really smell. And if that's mixed in, it can be very deadly and shut down the part of your brain which tells you to breathe. So the reason that we're expanding our distribution to all patients at the hospital is because they themselves could have somebody that uses substance in their lives, or it could be so that their family member could help them if they were to overdose, just to give them a second chance, and then they could always come back to us and be restabilized again.
That's fantastic. What do you see as the future for you and your team with this program that you guys have?
In May, we'll be hosting a table at the NAMI Walk. I'm not sure that it's May
So
26th.
it's on May 20th. It's the National Alliance on Mental Illness New York City Walk. We're going to be doing another table, a much bigger table than we've done before for Narcan. And some of the things that we teach people when we distribute the Narcan are about the Good Samaritan law that protects the person who calls 911 as well as the patient from any legal consequences. We also try to discuss stigma against mental illness and try to reduce stigma. So one of the things we're developing as well is a stigma busting team at Gracie. So that's something where we're going to focus on getting some of our nursing assistants out in the community to talk about mental illness in a much more open way, so that there's less stigma against people, so they feel more comfortable getting help in those earlier stages of mental illness.
Fantastic. Is there any other information that you want to put out there about your group, your team, just anything in general?
Well, I think we have a great team, very empathetic people. We are really into trauma reducing strategies, and we're very aware that there's a lot going on out in the world that our patients need acute stabilization for.
Awesome. Thank you guys so much. I appreciate your time.
Of course, thank you for
Thank
you.
having us, and we are so honored to receive this nomination and recognition, so thank you.